Go over to our guest for a second, Dr. G. Shreekumar Menon. He's the former director of the National Academy of Customs and Narcotics. He is with us. We'll go over to him to understand a little bit more about this issue and the problem. Dr. Shreekumar, thank you for joining us here on the show this morning. Dr. Shreekumar, I just want to understand from you, one of the aspects that comes up a lot when you take a look at reports that are analyzing this issue is they say that the conviction rate remains low in this because officials, while they are authorized to seize drugs and make arrests under the NDPS Act, sometimes there isn't a familiarity with proper seizure protocols and you end up having the improper handling of evidence in prosecution. How deep a problem do you think that is? Do you think that's an accurate analysis? Dr. Shreekumar, we directed that question at you. Were you able to hear us?
Yeah, I am. See, the NCB is a NDPS Act, is a very specialized act. And most of the enforcement agencies, like police, customs, including NCB also, are not very conversant with the strict provisions of the NDPS Act. See, when we go to a court of law, the court is interested only in the legality of the seizure. They are not worried about the other aspects, whether it has a social impact or whether it has an impact on the terrorism angle. So the court is concerned only with the legality, and there are very stringent provisions like for sampling. Now, most of the cases we are losing because of the incorrect sampling being adopted by the enforcement agencies. See, they have their own difficulties. Like, for example, most of the seizures happen during early morning hours. And at that time, to get a witness, or, maybe it's on the border area, whom will you get as a witness? So because of all these factors, you will find that the people who are doing the trafficking, they escape. Of course, the drugs are seized. So that is how it is, madam, that, because of the stringent provisions and the, lack of familiarity with the act, that causes the problem for all the enforcement agencies.
Okay, Dr. Menon, we came across one particularly stunning statistic that 90% of the drugs that are smuggled into the Northeast originate from Myanmar. And we just wanted to understand from you, the borders have been criticized as being, and this is one of the aspects Anvit, our colleague, just covered, that they are quite porous. Even though India is working its hardest to protect the borders, they are still quite porous. So what more needs to be done there?
You see, what you said is correct. It's a very large and porous border. The Indo-Bangladesh border as well as the Indo-Myanmar border is very porous also. We can't have, an army standing hand to hand and patrolling the entire area. So there are what you call many gaps, and but I have a different take on that, especially in the changed context of the Bangladesh actions going on against the minorities there. See, Yaba is a drug which is exclusively used by the Bangladeshis across the world. And it's a very cheap drug, though it is a combination of methamphetamine and caffeine. Methamphetamine percentage would work out around 25 to 35, and the rest would be caffeine. Now, this drug is manufactured in Myanmar, that too deep in the Shan state. And there are nearly around 50 laboratories working exclusively to produce Yaba, that too for the Bangladesh market. Now, there is no other way. It has to enter into India, or it has to come via the sea route, and it has to be brought. Now, the Rohingya refugees, you see, 2017 onwards, this problem has been happening. And more than 700 lakh people have, been rendered homeless, and they have all made their way into Northeast as well as into Bangladesh. So these people are absolutely helpless. They don't have money. They don't have a job. They don't have food to eat. So they find that trafficking in Yaba is very profitable. Now, see from the Bangladesh context. See, Bangladesh, many of your readers would not have heard about this. We are all familiar with Golden Triangle and Golden Crescent. But the Bangladeshis have a name for us. They call it the Golden Wedge. Now, it starts from Himachal Pradesh, covers UP, Nepal, and extends up to Bhutan, and then comes to the northern tip of Bangladesh. Now, from Himachal Pradesh, you will find ephedrine smuggling. The Bangladeshis, they gulp ephedrine cough syrup in bottles after bottles. Thousands of bottles have been seized. Even 2024, I think last month in November, the BSF has seized somewhere around 70,000 bottles of ephedrine. Now, there is another angle also here. There is something called as a silver triangle, comprising India, Nepal, and Bangladesh. In addition to that, what I would like to enlighten the viewers is that the river Naf, which strides Myanmar and Bangladesh, around 3 lakh vessels are plying on that every day. 3 lakhs, all sizes, from boats to big trawlers. And these are all bringing in Yaba. The Yaba addiction is very high in Bangladesh. It's at its peak. And though maybe slightly out of context, I should not be maybe talking in that vein, but I feel very bad about the happenings in Bangladesh now. And I feel that India would be doing well by conniving at this Yaba tree. Because Yaba can absolutely devastate Bangladesh. Be sure about it. Without even lifting or firing one shot, we can teach them a lesson.
So, Dr. Menon, I want to ask you exactly that next. We've talked a little bit about the borders and what India can do within its own country to better protect itself. But one thing we haven't touched on yet is diplomatic relations and diplomatic ties. My own research revealed that it was only back in 2020, in that same Shan state, the same area you were referring to, that you last had authorities from the country actually go ahead and identify the larger methamphetamine large-scale manufacturing that was taking place. And since then, it hasn't actually taken place where you've had the government of Myanmar identify manufacturing facilities that are of a large nature. What diplomatic powers does India have in a situation like this to pressure, for example, Myanmar in this context?
See, Shan state is almost like an autonomous state. And even the Myanmar government does not have much of control there because Shan state almost borders China. So, pharmaceutical products from China make easy entry into Shan state. And you would find that Shan is almost a hub, not only for Yaba, but for all kinds of deadly drugs. And from Shan state, you will find it goes into Thailand. And from there, it goes to Australia and New Zealand and other places. And from there onwards, it goes into the Pacific coast. Now, as far as this western side is concerned, you will find that Yaba has got a great demand in Bangladesh. So, the Yaba trafficking happens from Shan state. See, from Shan state, it comes to a place called Suite, which is the capital of the Shan state. And from there, it comes to another place called Mautong. And from there, it is coming into Bangladesh, Chittagong, and Barisal and other places it goes. Now, the problem is, as far as India is concerned, we don't have much of a demand for Yaba. Be very clear about it. Yaba addiction is not there at all in India. I can tell you very confidently for the simple reason that we have much better drugs. Cocaine is available now in plenty. Heroin is available. Methamphetamine is available. MDMA is available. Why should we go for a cheap drug like Yaba? So Yaba is what you call exclusively meant for Bangladesh, and you will find that the entire population of Bangladesh, cutting across the board, whether it is students or film actresses or actors or you take any segment of Bangladesh, they are maybe because of the religious compulsion. Like I told you earlier, they drink a lot of ephedrine, cough syrup, and this Yaba also is very much favored there because it is quite cheap. It's not expensive. See, you can't afford cocaine. Cocaine is a very, very expensive drug. And that is why this Yaba is what we
Okay.
call localized to as Bangladesh.
Dr. Menon, thank you for joining us this morning. Thank you for
Okay,
elaborating so beautifully on this topic and on this entire story, bringing us so much context as
thank you.
audiences.
Thank you.
Let's just go back to our colleague Anvit, who brought this story into the spotlight by bringing us this report. Anvit, can you tell our audiences what you would like should be their biggest takeaway as they watch your story?
See, first of all, synthetic drugs are something that everyone should stay away from. Not just synthetic, but also opioids, because the drugs have the kind of, and we saw Dr. Rolte saying that the kind of impact it has, and it can lead to heart failures and also brain seizures. So, in many cases, they have said that they have also witnessed patients dying because of prolonged addiction. And the story we did from Kashmir, that also had exposed similar threats of prolonged effects of drug addiction, be it heroin or cocaine or anything for that matter, be it synthetic or be it opioid based. Secondly, see, the police had been doing a lot of seizures and crackdowns, and that is why the number of seizures have gone up. Seizures are actually very significant. From 2020, where just only 7 cases of methamphetamine smuggling were registered, in 2024 the cases have gone up to 76. It's a 10-time jump. When the seizures are concerned, from 548 seizures to 1631 seizures, it has really gone up, and this is highly indicative because not only the seizures of meth has increased, but also more than 1,000 kgs of caffeine were intercepted in Mizoram just this year. It's this combination is highly indicative that Yaba is becoming a threat. Also because it's cheap, it has a prolonged intoxication. People are going for it. Youth is going for it. So the Social Welfare Department of Mizoram has also been doing a lot of welfare programs and educative programs to tell the youth that they must not get into it. Also, one factor is that Mizoram is a dry state. So when you don't have alcohol, people go for such cheap substitutes, or we can say that dry substitutes or synthetic based drugs, because to get that high, alcohol is not available. Also this has led to some clandestine party places in Mizoram which police keeps on raiding again and again. We also got to know some of them, we visited them, but as an outsiders we were not allowed, even in the periphery of those areas. So it had been quite a challenge. I and my video journalist Guneet Singh Bedi, we traveled across dozens of villages along Champai and along the Zote and in the Tiau river, and that is what led us, helped us to get this kind of coverage, detailed coverage, and to find out what are the repercussions of such drugs that are continuously growing in the regions like Mizoram because of its proximity with Myanmar, which is seeing a regime change and the rebels have taken over the government.
Anvit, we're grateful that you did. We're grateful you brought our audiences this perspective, insight into how the entire region functions so that we can have a deeper understanding of this entire issue. We're going to head into a quick break. On the other side, we return to other national stories, so do stay with us.